Okay, well, thanks very much for the invitation, Fiona, and thanks to all of you for tuning in. Um, I guess if you're looking around the world today and all the headlines, everybody's feeling pretty kind of overwhelmed and depressed with everything. And if you're looking for a webinar to kind of lift your spirits and to cheer you up, as you can see from the title of this one, it might not be the one for you. This is another not necessarily cheery talk, but in compensation, I'll try and present it in a reasonably engaging way. So as you can see from this first opening slide, this is basically a shameless plug for a book, as Fiona mentioned. But I defend the shamelessness on two counts. And the first is the importance of the topic, which I'll explain to you, and you'll hopefully agree with me. And secondly, although it is a shameless plug for a book, we're not actually making any money from the book. And I'll say a little bit more about that later on. So it's a kind of morally defensible level of shamelessness, what we say. So what I'm going to do today is just give really quite a brief overview of the book, and that's for two reasons. The first is nobody really wants death by PowerPoint at Monday lunchtime, but also I know that by the end of the presentation you'll be absolutely desperate to buy a copy of the book, and I don't want to ruin it all for you by telling you everything that's in it. So what I'm going to do is just sort of dip a toe into every chapter just to give you a few kind of like high-level headlines, if you like. So in relation to what's happened to life expectancy and mortality rates in the last 15 years or so, and importantly, why. I'll very briefly talk about what's happened elsewhere. Some of the changes to life expectancy, as you'll see, have been pretty dramatic, and so I'll very briefly talk about whether there are other things we need to think about in interpreting those changes and interpreting those trends. I'll equally briefly talk about what some of the responses to the evidence have been from particular organisations, particular places, and then I'll contrast that with the responses that are really needed. Now, by the point I get to this part of the talk, two things will have happened. One is you'll be even more depressed than you were when you joined the talk. But secondly, despite that, you will be absolutely desperate to know where you can buy a copy of the book. So I'll put you out your misery at that point by moving into sleazy salesman mode and telling you exactly where you can get the book if you do want to do that. All of this should really take only about 25 minutes from now, I think. So that should hopefully leave plenty of time for questions and discussion. And it's not for me to say what questions you should ask, but questions like, can you tell us again where we can buy a copy of the book? I think are always quite good ones. Okay, so on the right-hand side of your screen then, you see the cover and indeed the title of the book. And I would guess possibly your eye is drawn in particular to two words in that title. And I'll come on to that in due course. But I actually want to start by talking about two other words that feature in the title, which is life expectancy and what exactly life expectancy represents. So obviously you all know it as a measure of the health of a population, and it is. It's a very good summary measure of how long, on average, people are living currently, not in future, currently in a population. But we would argue very strongly that it's much more than that. It's actually a measure of how well that population is doing, how well that population is faring, arguably how well looked after that population is. And if you accept that, then if you look at life expectancy over time, it becomes a different kind of indicator. It becomes a much broader marker of overall societal progress. And I say that because in rich countries, and as hard as it is to believe and remember, England, Wales, Scotland are all very, very rich countries indeed. In rich countries, life expectancy has gone up decade after decade after decade. If you're looking back well over 100 years, as this chart does, the only times that life expectancy has not gone up have been times of, profound societal crisis. So basically world wars, pandemics. Other than that, life expectancy has gone up and up and up and up and up. And indeed, at the start of the last century in England and Wales, people were only living on average into their 40s. And not that many decades later, people were living more than an additional 30 years. That's an extraordinary change in a relatively short period of time. And clearly it's reflecting all these different aspects of societal progress. So yes, medical advances, but also better living conditions, which protect the population. Public health success stories like vaccination programs, which protect the population. And of course, in the UK in that time period, we had the establishment of the welfare state, which was a prescription for, quote unquote, from cradle to grave societal protection. So perhaps the only thing more astonishing than this continual rate of improvement has been the fact that about 12 or 13 years ago, this all kind of ground to a halt. It all kind of stopped. If we zoom into the last 4 decades, we see this a lot more clearly in terms of life expectancy stopping going up, that's Scotland, and mortality rates, which basically show the same thing as you know, but in a different direction. They come down as people live longer on average. Mortality rates pretty much stop coming down, and that's England. And seeing as I'm speaking, I think, largely to people south of the border, let's just zoom into this example for England, because the really important thing about this picture of the cessation of decades-long improvement is that obviously this is not about the wealthy in English society. If you look at mortality rates for people living in the least deprived areas, then although there's a very slight change in the trend, importantly, death rates continue to come down, meaning that, again, on average, people are still living longer. But it's very, very, very much about people living in the more deprived areas where fairly believably, really, mortality rates stopped coming down and actually started to go into reverse, actually started to go up, meaning that on average, people were actually dying younger rather than living longer. And it's important to emphasize that this isn't the 1% most deprived population or the 2%, those somehow on the kind of edges. This is a fifth of the whole population of England. And in a country as rich as England, this should just never, never, never happen. The picture in Scotland, where I'm based, is basically exactly the same, increasing death rates among people living in the 20% most deprived areas. This has all been made worse by the COVID pandemic, obviously. If we add in the two sort of peak COVID years, you see that very clearly. But importantly, the changes predate COVID by a good number of years. Some of the changes that we've seen to these death rates are absolutely extraordinary, and they're seen everywhere across the UK. So, more or less pick a city, any city. This is Liverpool. These are the death rates among people living in the 20% most deprived areas of that city. They were coming down, of course, as they should do, then they stopped, gone into reverse, sharp increasing death rates. Pick another city, how about Leeds? Dramatic increasing death rates among people living in the 20% most deprived neighbourhoods of that city, and spectacular widening of inequalities there. And here in Glasgow, where I'm based, if you look at premature mortality for females, you see an absolutely dramatic reversal of previously sharply falling mortality rates, again among people living in the most deprived areas. And it's worth just zooming into this particular one to make the obvious point that if you go back in this chart a decade or so, then actually what we had was, relatively speaking, a bit of a success story for this population, in the sense that death rates were coming down overall, but they were coming down actually more sharply among people living in the poorer areas. So that's actually a picture of narrowing inequalities, what everybody wants to see and what politicians claim that they want to achieve. Fast forward through the next dozen years or so, and death rates in the poorest areas had become higher than they had been 20 years previously. This isn't the societal progress I was talking about earlier. This is societal regress. And all of these changes, as the subtitle of the book points out, coincided with the implementation of the UK government's austerity programme, which has cut public spending on a truly astonishing level. I don't have time to get into this today, but the book goes into this in a lot of detail. It's cut public spending on an absolutely mammoth scale, impacting therefore on vital public social services that large sections of the population require, depend on and need. And within that is also seen, as you know, cuts to social security, again on a truly astonishing scale. And social security, as you all know, is a safety net for people living in difficult circumstances. So if you take that safety net away, what happens? Well, what the data show are that people die, and they die younger, and they die in increasing numbers. And this is obviously all quite emotive language. And in public health, and although I now work in a university, as Fiona knows and mentioned, I spent a number of years in different public health organisations. And in public health, it's always very important to be clear about whether what you're saying is evidence-based. But the answer to this question, is there evidence to support this, is a big fat yes. There's absolutely masses of evidence. And indeed, the whole point of the book was actually to bring all that evidence together. And I think the evidence sort of sits in 3 different layers. On a slightly more abstract level, and I'm not going to go into any detail today, there is obviously a huge evidence base, a huge literature on the so-called political determinants of health, the fact that political decisions so clearly impact on the health of populations. Much more relevant than that is the increasing numbers of international studies of the detrimental impact that these kinds of austerity policies have had on population health. And this now comes from a whole number of different studies across a whole number of different countries. And I'll come back to this last paper, which was led by the co-author of the book, Gerry McCartney, just in a wee second. But much more relevant even than that, I think, is the absolute wealth of evidence from within the UK of the impact of the particular form of austerity that's been implemented here, with its focus on the needs and the income of the poorest and the most vulnerable in society. And we see this impact along really well understood causal pathways. So in terms of, first of all, increasing levels of poverty, and I'll show you some stats on poverty in a second, but we also see it from a whole number of studies that have showed the impact of austerity on increased food banks, for example, or the impact of austerity on increased levels of homelessness. We see how that therefore impacts on poor mental health. And in the book, we go into a little bit of detail around the very solid evidence between poor mental health and poor physical health. And this all includes the poor mental health of particularly affected populations. Lone parents are one group, but other groups have been particularly affected. And how this therefore trickles through to changing death rates across different age groups. This study here was a study looking at old age mortality, but importantly, we've seen changes to every single age group in relation to death rates. And we've also seen changes for all the major causes of death. This particular study was looking at the impact of austerity on increasing drug-related deaths across Britain, but we've seen changes in all the major causes of death. Therefore, this all filters through to overall changes in life expectancy and mortality rates in Scotland, in England, and indeed across the whole of the UK. So that question, is there evidence to support this? The answer is there's bloody masses of evidence to support it. And what's really important about all this evidence is it comes from people working in different countries, and within the UK, people working in different research centres using different data sets and different methodologies, but all coming to the same conclusion that these policies fundamentally harm the health of large sections of the population. And I would go further, and in the book we go further to say actually these policies have fundamentally altered the society we live in. And I mean that with regard to a whole number of different aspects. So I've already mentioned food banks, for example, but it's worth just stopping and reflecting for a second that food banks have now been pretty much normalised in our society. You know, you go into a supermarket, there are collection points for food banks. You turn on the TV, they're talking about food banks. But prior to 2010, which is when these austerity policies first kicked off, food banks didn't really exist in the UK. There was quite a nice paper from colleagues here at Glasgow and also at Heriot-Watt University, which quantified this. They talked about how food banks prior to 2010 basically only existed on the periphery of society, but then quantified the incredible increase. Even if you don't want to look at that paper, if you look at some data from, for example, the Trussell Trust Network, only one, albeit one of the bigger suppliers of food banks, you see this extraordinary change in the provision of food parcels over a relatively small number of years. Clearly, this is linked to poverty levels, and child poverty rates, which were coming down prior to austerity, have gone up ever since. And child poverty is a really important indicator here, because, as I said, there are some groups that have been more affected by these policies than others, and younger families with children are one of those groups. And actually, the increases in child poverty in the UK in recent times have been shown to be worse than any other high-income country, as you see from these data. So this is proper shameful stuff. I've already mentioned mortality trends, but it's worth just making the point that in relation to drugs death, which I've already talked about as well, there's very clear evidence that austerity has exacerbated an existing drugs death crisis in Scotland, but also across the UK. So solid evidence looking at the impact of cuts to services alongside cuts to the income of vulnerable people have seen a massive increase in drug-related deaths within a couple of years of austerity coming in. It's also seen in relation to different indicators like healthy life expectancy. As I'm sure you all know, this is a measure which combines data on not just how long people are living, but how long they're living in good health. In a wealthy country like Scotland, or indeed the UK, because the data are similar, this should go up and up and up and up and up. It's actually been going down. And in the poorer parts of Scotland now, people are only living in good health on average into their 40s. when does a statistic become a scandal? We see it in relation to mental health trends, which, as you know, are going in the wrong direction for sections of the population. In one of the chapters of the book, we lay out a lot of the evidence of the effects of different aspects of so-called welfare reform on poor mental health. And we've even seen it in relation to quite different outcomes, like the number of babies being born prematurely and or of a low birth weight in poorer areas since the onset of austerity. It was coming down before that. It's been going up ever since. And that's been shown to be driven by the effects of maternal stress on babies growing in the womb, driven by financial stress, increasing levels of poverty in those areas. And you may or may not have seen some coverage of this in the media a few months ago. And there's lots more besides, which we go into in detail in the book. But I sense, even through the medium of teams, that there's already increasing level of depression. So I'll probably stop there with regard to that. So if there's evidence of an altered society, is it just the UK, or is there other places where this has happened? So it's not just the UK, because obviously austerity was introduced in lots of countries following the financial crash of the mid to late 2000s. But comparisons are really, really difficult because different types of austerity were implemented in different countries. And also the context matters. You know, if you're living in a country with a very robust welfare state, that's clearly in a better position to withstand the effects of these policies, rather than one where the welfare state has already been kind of stretched to breaking point, like, I don't know, the UK maybe. But nonetheless, the evidence that does exist shows that wherever it's been introduced, it's had a detrimental impact on mortality rates. So again, just to dip a toe into just one chapter of the book, we lay out trends for a whole set of different high-income countries. So if you just look at the UK at the bottom here, the dark line is obviously mortality rates. The dotted line is what should have happened to mortality rates had the previous trends continued, and this is obviously the divergence from that. But the point here is, if you look across these different countries, similar things happen to a greater or lesser extent elsewhere, but not everywhere. So if you look in Japan, for example, where mortality rates were already lower, life expectancy already higher, the trends actually just continued along the previous trajectory. And that paper I mentioned a minute ago, led by my co-author of the book, Gerry McCartney, which Gerry did as part of his 12th PhD or whatever he was doing at the time. Gerry's a man who doesn't get out the weekend. This used very tightly defined economic measures of austerity, which are broadly comparable across countries, and also very, very robust statistical analysis. And that basically showed that across all high-income countries, wherever some form of austerity was introduced, it had a negative impact on mortality rates. Or to translate the last sentence into English, it harmed people, and it harmed people on a huge, huge scale. So the changes to the trends are pretty dramatic. I've only shown you a few examples, but there's lots more I could have shown you for different places across the UK. But it does beg the question, is this just about austerity, or have other things played a part in all this? So a good number of years ago, people were suggesting that the historical increases in obesity rates would eventually impact on rates of health improvement in the country. And that is the case, but it only accounts for a very small proportion of the changes that we've seen. I don't have time to go into the details here, but we looked into it in a bit of detail in a paper published 2 or 3 years ago. And without going into all the details, if I could just show you one quick example. These are, again, mortality rates, the red dots over time. This is for males. This line here is obviously what should have happened to death rates if the previous trends continued again. And if you can see them, the blue dots are what mortality rates are estimated to be if the increases in obesity had not taken place. Okay, so in effect, basically, mortality rates would have been lower, but only a wee bit lower. They don't really account for a great deal of that gap. The COVID pandemic is obviously massively important in understanding the scale of inequalities that exist at the moment across different parts of the UK. But clearly they only account for, the tail end of the charts that I've been showing you. And similarly, the post-pandemic cost of living crisis, the high levels of inflation, is obviously also important because of its impact on poverty and poverty's impact on mortality rates. But again, that's only relevant to the tail end of the charts I've been showing you. So the point is, all these things are hugely, hugely important, but they're not the underlying or the principal drivers of what we've seen. The evidence shows very clearly that those are austerity policies that I've talked about very briefly. Okay, quite an important question is how has this been allowed to happen in a so-called civilized society? So even before we wrote the book, we'd obviously been doing a lot of work, a lot of research around different aspects of austerity's impact. And one of the things that kept coming up when we were presenting that in different meetings, different fora, was the kind of lack of awareness around all this. And when I say lack of awareness, I mean lack of awareness around the general public, but also on the part of a lot of politicians we'd spoken to. And that gets into a discussion about whose fault that lack of awareness is. You know, is it our fault as researchers for not disseminating the evidence properly? Is it the fault of the media for not doing that? Is, as I referred to at the start of the talk, is there just so much shit going on in the world that people just can't take in any more bad news? And various other kind of things as well. And in the book, we talk about this lack of awareness, but not so much about those contributions, but more about the roles of individuals and organizations which have power and influence, which have ignored or downplayed all the evidence around austerity. And I include in that particular influential think tanks. South of the border, Public Health England certainly, and other organisations like the World Health Organization. So again, just to dip a toe into one of the chapters, we lay out a kind of timeline for when and how all the evidence emerged and show that by 2019, for example, the Health Foundation think tank had a report which said that there was limited and inconclusive evidence for austerity in the changed life expectancy and mortality trends. Limited and inconclusive evidence. This was at a time when 44 separate studies had been published showing the impact of austerity on mortality rates. Similarly, 3 years later, the King's Fund brought out a report saying that the causes of the change trends remained unclear. And this at a time when 59 separate studies had been published showing the impact of austerity rates on population health. So in the book, we get into a bit of a discussion about why that's the case. But the important point here is, I think, is that it represents a profound dereliction of public health duty on the part of many, with the importance really being about the fact that it allows or has allowed the UK government to hide behind these various reports and this falsely created sense of uncertainty to basically deny any responsibility for what they were doing and, importantly, to continue doing it. So in contrast to that, what kind of responses do we need? So in the final chapter of the book, in frankly a desperate attempt to end the book on a more positive note, we lay out what the policy responses are required. These are basically a set of evidence-based policy recommendations, and as such, they build on previous evidence-based recommendations, which themselves build on previous evidence-based recommendations, because recommendations have been made by all sorts of researchers, groups like Child Poverty Action Groups, Joseph Rowntree Foundation, Oxfam. At their heart, they're about obviously reversing what's happened since 2010, so to create a social security safety net, to invest in vital services that people need to live healthy lives. And more broadly around narrowing health inequalities, it's about following that evidence around what works to narrow societal inequalities, because that would have a knock-on effect, a knock-on impact on health inequalities. The point here is this is not rocket science. All this stuff is out there and published, and it's all evidence-based. But it requires political will, and therein lies the rub, as they say. I'm going to, just as a quick warning, I'm going to show you a reasonably offensive photograph now. So just to warn you, in case you're having your lunch, it could have disastrous consequences. There you go. So it's worth just reflecting and remembering that austerity was kicked off in 2010 by the Conservative Liberal Democrat coalition government. And in that first parliament alone, they implemented more than 150 separate changes to the social security system, impacting on levels of social security and eligibility for social security, which affected the lives of extraordinary numbers of people. In the subsequent Conservative-only governments, they implemented many, many more changes on top of all those. Now, clearly, there's a different government in Westminster now. It's a Labour government, so obviously that's a cause for just sort of dancing in the streets, general kind of laughter and merriment and celebration, except that, hold on, first of all, I think two things to say. First of all, not one of those hundreds of changes to social security has been reversed by the new UK government. So in that sense, austerity has never, ever, ever gone away. And secondly, as you all know, Labour has now embarked on its own set of cuts, cutting £5 billion from so-called welfare, and again targeting a very, very vulnerable section of the population, people with disabilities. So it's obviously vital that this new government or newish government understand the evidence of the harm that austerity policies cause and take the right course of action, not the course of action that they are taking. This last bullet point I wrote before the most recent policy announcements, and I'm not sure it quite does justice to the situation we're in. Okay, for those feeling very, very depressed now, just to kind of reassure you, we're kind of in the home straight now, and I'll finish shortly. So we prefaced every chapter in the book with a different quotation, and this quotation you see in your screen here was attributed to the epidemiologist Austin Bradford Hill, that a number of you, I'm sure, will be familiar with. And he said that health statistics of the type I've been showing you and throwing at you today, health statistics represent people, but with the tiers wiped off, which I just think is a brilliant way of getting to the fact that behind all these charts and bits of data and all the rest, lie the stories of real individuals affected by all these policies. And in the book, we intersperse all the evidence with 7 real-life stories of people affected by these policies, and 4 of them you see on your screen at the moment. I'm not going to get into all those stories today, other than just saying that each one is illustrative of a different aspect of austerity. So from people who were too ill to work, but were forced to work by the system with horrible, disastrous consequences, to examples of people affected by cuts to social care and housing services, by the bedroom tax in England, examples of the so-called welfare reforms on people's mental health and on people who use drugs, and then the truly pernicious social security sanctions, such a horrible word, the punishments dished out by the system on people that the system thinks aren't doing what they should do. And we also dip a bit into the qualitative research. So Gerry and I we work more on the quant side, but qualitative research is just so important in terms of getting at those so-called causal pathways and truly understanding how these policies impact on people. Just to quote one study, how they impact on people, making them feel like their world is collapsing around them, damaging them both physically and mentally to the point where they think they can't go on. About people who have to rely on their children for something to eat rather than the other way around, and how that makes them feel. People taken to the stage of saying, well, what's the point? I can't go out, I can't see people, I can't even eat properly. And just one aspect of austerity, the introduction of universal credit, being described in this one study as being like insidious brutality. So, what does this insidious brutality and everything else I've spoken about all kind of add up to? Does it add up to the title of the book? So, as I'm sure you're all aware, this is not an expression we coined. This is an expression used most famously by this man, Friedrich Engels, who was a German philosopher, social scientist, writer, and many, many more things, including, as you see here, an early champion of the hipster beard. And he used this expression in arguably his more famous work, or one of his most famous works, The Condition of the Working Class in England. And this was a book he wrote when he was working in Manchester at the height of the Industrial Revolution in the 19th century. And he used this expression to describe the appalling working conditions and the appalling living conditions that were prevalent in Manchester at that time, and which were directly connected to the appalling dying conditions, because Manchester, like a lot of industrial cities at the time, was characterised by very high mortality rates, including very high child mortality rates. And in using this expression, his anger was directed at the private landlords and the factory owners who were profiting from this human misery, but also more broadly at those in society with power who allowed those conditions to exist and persist. And in that more latter sense of talking about people with power and responsibility who make decisions that harm others, this term social murder has been used in lots of different contexts since the time of Engels. So in relation to the Grenfell fire tragedy in London, for example, in relation to the government responses to COVID or lack of responses to COVID, and indeed to different aspects of health inequalities, because health inequalities are entirely political in nature, and that includes the role of austerity, because austerity has been a political choice which has harmed extraordinary numbers of people. So in the book, we just kind of lay out the evidence and we leave it up to the reader to decide what the most apt description is. Whatever the description you want to use, it's a politically created tragedy which really, really desperately needs a political response. And in the various book launches that we had and various presentations we've done since then, I've been sort of half facetiously encouraging people to buy a copy of the book, but then to send it to their MP so they might have a greater chance of understanding some of this evidence. And when I say half facetiously, I only mean half facetiously because I think we do need to do whatever we can do to make people aware of this evidence. And before we're accused of cashing in or being hypocrites, I would just like to emphasise, as I mentioned at the beginning, that we're not making money from the book. So all royalties, and excitingly, the current projections suggest they could be as high as in the tens of pounds. All royalties don't go to the authors, they go to NHS charities. The original book launch, when I had this slide, I was taken aside afterwards by one of my comms colleagues who said you need to be more kind of upbeat and more kind of progressive about other ways of shouting about this. You need to say a bit more about getting the word out, and she was absolutely correct. So there are other ways that we can shout about this. I recommend buying multiple copies of the book and then circulating them. But when we did the book launch, we also had to do all sorts of cringe-worthy videos, which can be shared. We've done all sorts of blogs and podcasts. So if you are keen on getting the message out there, there are lots of things out there that can be shared. You can also publish your own blog, or if you work with different groups, feel free to ask us to come and give a talk to those groups. I'm recommending Gerry here just because he's not here today, basically. Also, just get in touch with people with power to make people aware of all this evidence. Basically, anything and everything we can do. Moving into sleazy salesman mode, if you do want to buy a copy of the book, it is available from all good bookshops, etc., etc. If you want to buy it from the publishers and you sign up to their newsletter, you get a bit of a discount. The book came out at the end of last year, to be honest, though, so I'm sure if you look carefully in second-hand bookshops, you can get it for about 50p. I'm going to kind of stop there. I'm just going to leave up this slide of a list of people who helped with the endeavours of writing the book. I'm not going to read them out, but I would just mention the one at the top, which is the members of the families of some of the individuals we feature in the book who gave us permission to use their loved ones' stories, and it was quite humbling, really. And at that point, I'll stop. We're going to do a few questions now, which is fine, but on the bottom right there, you can also see my email address, and if any questions pop into your head after the talk, please feel free to get in touch, and thanks for your attention.